Hello, Dr. Dharmesh. I'm Bachelor of Ayurvedic Medicine and Surgery, Master's Sports Biomechanics and Kinesiology, MPhil in Sports Biomechanics and Kinesiology, PhD in Sports Methods and Training. I'm an Ayurvedic Specialist, Sports Therapy Consultant, and Assistant Professor, Sports Therapy in National College, Research Department of Physical Education and Sports Science. Welcome you all to the website and to know about Marma therapy. What is Marma therapy? It is Indian-based manipulation method. Like our body is made up of muscles, bones, ligaments, joints, blood vessels, where the Atma resides. We will be doing all treatment when the Atma resides in these structures. The union of these structures, where the prana resides, is called Marma, Bindu, the Marma point. Why it is very different to hear about Marma? It is not like any science or anything like a modern name, because it was written in Sanskrit literatures. It's a Sanskrit name of Indian language. That's what you may think like, what is Marma? I cannot able to understand. This is the scientific method of therapy written in Sanskrit literatures by our acharyas, great gurus. Marma. There are 107, 108 and 365 points. In our Indian system of medicine, there are three types of Marma. Like Siddha based system, which is from Kanyakumari, our southern India, which is more practiced in Kerala and Tamil Nadu belt, and Marma, that is 108 points, that is practiced all over India, Sushruta based. 365 vital points, Kalaripayat and Adimurai. All these are like king of martial arts and the masters of martial arts. And in this, we have specialized technique and martial art technique, injury prevention, and then how to rehabilitate the injury. We have all literatures, and then we are following so many things regarding this. In Marma therapy, mostly it is external therapies. Actually, there is a lot of injury, and then we need to go ahead with the continual treatment for major ligament injuries and all. We can go for internal medicines. And if you want to have a proper rehabilitation and body building and everything, we have internal medicines. And breathing is the most important thing you need to follow. There are 4 techniques mostly: traction method, manipulation method, opposition stabilization method, bandaging technique. Manipulation, like traction. What is this? Traction means when a person is lying down, you are pulling one of the joints, like a leverage. Okay, the body aligned by itself. That is a kind of manually alignment. Okay, it's a manual therapy. And manipulation of muscles, bones, ligaments, joints, blood vessels, and all this combination. We just manipulate it separately, mostly to enhance the free range of joints. And opposition stabilization. When seeing that, when there is a facet lock, so you have to stabilize one joint and then rotate the other joint in the opposite way so that it aligns by itself. It's an opposition and stabilization. We can do that opposition stabilization in different joints, like cervical region we can do, and shoulder region, for wrist joint, hip joint, knee joint. and bandaging technique. Bandaging technique is nothing but it is like using of restriction of joint movement, immobilization, they say. These are the four techniques. People are unaware of this Marma therapy because they think like this is something different because of the name, since it is written in Sanskrit. See, I will tell you, one of the synonyms of Marma is Udimuri, they say. Udimuri means what? It is fracture treatment. See, it's a fracture treatment. Treatment for injury. It's a simple. Marma therapy is treatment for injury. Okay. Also, there are several concepts of therapies are there. When a person is injured, we have a treatment. When to make a person injured, we have a technique. Just to enhance the self-healing energy, we have a technique. It's all. Now, how Marma and sports are connected. Our body is made up of Panchamahabhuta and Atma. Okay. When we get injury, our body self-heal by itself. Most of the conditions, our body needs to self-heal by itself. The self-healing, the enhancement of the self-healing, the main aim of the Marma therapy. When our body, I told what is our body is made up of Panchamahabhuta and Atma. When Atma is inside, we do all the things. We play, we just eat, we just sleep, we do go for treatment and everything. When the Atma escapes, our body is again a Panchamahabhuta. We do rituals to give back our body to the Panchamahabhuta. Right? When we are about to give such thing, our body is buried in the soil or etc. Like in another Panchamahabhuta, the bone remains. What is the relationship between the bones and the natural healing energy? When bone is in the position, right? Bone is in the position, like our joint is in the position. Our healing energy transfer without any blockage. When there is a joint blockage, the joint is moved towards the anterior or posterior or inferior. What will happen? Our body will, the transmission of energy will be blocked. So our Acharya Sushruta, Agastya, Vagbata, everybody so told how to realign this body. They gave 4 methods like traction method, opposition stabilization, manipulation, and bandaging. Bandaging is the one of the technique. Worldwide it is practiced because it is a natural self-healing energy, enhancing the natural self. If there is any sports person injured or any common person injured, whole world, the orthopedic world, what they will do, they just keep the joint in a position and then bandage it in its angle. So keep the rest, the healing happens by itself. Same thing, our Marma therapy has so many protocols to do in the natural healing. How it is communicated, how we can relate Marma therapy with the sports. Very nice question. Actually, in the olden days, when a community has to show power on another community, they just fight war. In this war, there will be a lot of war injuries. Okay, they have treated with this indigenous system, and they have lots of treatment about like bandaging and healing, internal medicines, exercise therapy through yoga. So much are there. Same thing, now we are cultured. We are doing sports. So when anything happen in sports and the injuries can be easily treated through the Marma therapy and Ayurvedic system of medicine. When there is a lot of pain in the knee, if you take an example, in the knee, any grade 1, grade 2 injuries of like cartilage or tendons or like meniscal or ligaments, when you bandage and then do the rehabilitation properly, the natural healing energy will just bring back the injury to the normal. And then all the joints, like if you take the knee, the patella femoral joint, and all the three compartments has to have its own space. So we have in Marma therapy, we have manual technique and manipulation technique. What is manipulation technique and what is manual technique? Manual technique is nothing but when we align the body in opposition stabilization or traction method, the bone joints adjust to its normal articulation. Okay, that is manual technique. And then manipulation. When there is a facet joint block in the L4, L5 region or lumbar, we just check the area and then do the opposition stabilization technique. I'll just keep some of the pictures for your knowledge. So what happened when we rotate and then it opens by itself. And then the most important joint for everyone is like Atlanto-occipital junction. Our Sushruta, Charaka, and Agastya have given this is the very vital point. Point in that. When you see that in this joint, in the upper joint, it has to be in a position to transfer the healing energy. So we have a technique to correct this. There is a lot of people thinking about Marma therapy or Ayurvedic therapies or indigenous system will give a very late response. No, that is wrong. We have a very instant relief in very different conditions. We have very instant relief. For example, ankle sprain. Our Rio Olympics champion Kevin Cordes. I have treated him when I went to Singapore to class. They invited me to take a lecture on sports injuries and Marma therapy in 2014 December, and there I met Kevin Cordes. He's a swimmer and breaststroke swimmer specialist. During his one of the training days, he sprained his ankle, and then I found that this ankle joint Marma is injured. I did Ayurvedic therapies and bandaging technique and manipulation. And post, I just gave him strength conditioning exercises like single leg, and then already he's following so many exercises. And then I just incorporated some of the exercises. And happiest news is like after preceding years, after a few months, he got gold medal for his country. That was so great news for all of us. And Vignesh Hariharan, kettlebell champion. Last year, 2019, he went to Australia. He was training for 1.5 years for that event. He came out with severe knee injury and joint injury and blockage in the neck. Then I found his Atlanto-occipital junction in trouble and facet joints in a problem, and knee, all the compartment are squeezed because of his heavy lifting. And then every time he goes for a hyperextension of the knee, then it's just we have like 1 week of time. Then I gave him a treatment and then adjusted all the joints, and then I put him on some special diet. Immediately the pain reduced. He won a gold medal and won silver for our India. So he is a world champion now. There are so many cases. In our sports therapy departments, we have a fastest woman in India. So we used to give lots of tips and lots of posture, biomechanics, and everything incorporated with these Marma points and Marma manipulation. We give lots of importance to Marma therapy. Uh, Mostly the integration part is most important with proper diet, exercise, and all. So we got lot of relief and lot of uh, improvement in athletes. When when an injured athlete is suffering, first, if he cannot able to play a normal sport, he must rest for some time. And icing is the most important thing. Always check for a joint alignment. That's the most important thing I need to give you. You need to check for joint alignment. How you will check for joint alignment? You can visit any doctor nearby, any physios or any Marma therapist. You can call us directly and then we will explain you. So like a spine needs to be in a proper position, and it is like a palpation method, and we have like a different rotation techniques to put back. Self-help therapy we have, you can contact us for self-help therapy for the joint alignment. If the joints are in a position, you can able to easily get high performance. Conclusion, like Marma therapy is more scientific, more effective for sports people. We have treated plenty of people. I'm a head of the sports therapies in our research departments of physical education in sports university. We have like hundreds of sports people who are getting more benefit from our Marma therapy and its integration with other sciences. So it is not a new one to take it to your brain. It is our old system, and then it has lots of scientific reason behind this. Okay, to sportsdirect.com for giving me this opportunity to talk about Marma therapy. Marma therapy, it's a joint spacing technique. It has a manual therapy, it has a manipulation therapy, it has a bandaging technique, and it is a natural. It enhances the self-healing energy. Okay, just keep it in mind. And whenever a person is having a pain, 100% it is joint blockage. So talk to us, keep in touch. Dr. Dharmesh from Tremors and Traumas.